Portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. And we've been hearing so much recently, Doctor, about the opioid epidemic. And I think when people hear that, they think, well, that's happening to somebody else. How bad is it really?
Amanda, it's strikingly bad. The newest report is that about 142 Americans die each day because of an overdose. And I'd like to contend that the effect is much more extensive than just in the death toll. I believe that the quality of life is diminished for all those who still live, just in terms of their restricted freedom because of their addiction.
So my mind goes to pharmacies and some of the people who might control some of these things. What are those agencies, those groups, those people doing about this problem?
Well, really the focus now is on those first-time users, those who innocently receive a prescription for one of these opioid medications to treat their pain. And so the idea here is to limit the number of those pills given from an average of about 22 days worth to about 7 days or 10 days.
Mm-hmm. I want to ask you, switch topics if you'll allow me to, because I think this is so interesting. Weight control and student athletes. I see this at this time of year with wrestling and with a number of other sports, with gymnastics. Talk to us about this.
Yeah, it involves wrestling, of course, gymnastics, cheerleading, swimming, diving. But it's also on the other end where some student athletes are trying to actually gain weight, as in with football. Mm-hmm. And this is a really big concern because these are young, developing bodies.
And a lot of people are doing things wrong, either putting on too much weight or too little weight too quickly. What's happening
and
here?
Those are the key words, Brian. Yeah. Too quickly. Really, any change in weight should be gradual. Generally no more than a pound or two in a week.
So what happens if they don't follow the recommendations? I mean, what's the risk?
Really, the risk is damage to their health, but also it could yield adverse performance. That is, paradoxically, they may be trying to improve their performance when this abrupt change may actually reduce it.
I want to quickly address new blood pressure guidelines for children. Parents might be a little surprised, right, when they take their children to the next wellness visit?
That could be because the blood pressure tables have been updated. And so the practical effect is that more children may be diagnosed with high blood pressure.
Oh, my goodness. And what would high blood pressure be for a child?
Well, it really depends upon their age and their gender. You think of the normal thresholds for an adult at 120/80, somewhat less for depending on the age of the child. But more of these children will be diagnosed, and I think that's actually maybe a good thing because we'll be quicker to identify those who need the help early on.
Interesting.
It's always good to talk to you, Doctor. Thank you. This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield, and that's here on KSL News Radio.